Hi, my name is Dr. Charles Feinstein, and I am a specialist in urinary incontinence. What is incontinence? It is the involuntary loss of urine that leaks without control. Why does it leak? There are many different options. The two most common causes of leaking are, number one, stress incontinence, which means that you lose urine when you cough, sneeze, laugh, when you do any exercise, jumping, dancing, running, any kind of aerobic exercise, Zumba class, martial arts class, Latin cardio class. Incontinence when you're having relations with your husband. Incontinence when you're screaming at your kids. That's called stress urinary incontinence. That's usually successfully treated with a 15-minute surgical procedure. The other type of incontinence is called overactive bladder. Overactive bladder is that jingle that you've heard on the television. The one where the lady is going, gotta go, gotta go, gotta go right now. That is overactive bladder. There are two types of overactive bladder. Number one is dry overactive bladder, and the other one is wet overactive bladder. Dry overactive bladder means that you have to go right now, but you get to the bathroom in time without leaking. Wet overactive bladder means you gotta go right now, but you leak before you get there. That's a very embarrassing problem. It's why women spend over $6 billion a year buying absorbent pads. That was $6 billion. That's B, as in billion. That's a lot of money. That's a lot of pads. The treatment for overactive bladder is usually medications, not surgery. The medications have been available for over 10 to 20 years. They're mostly all successful, but they mostly all have side effects. And the side effects can range from constipation to dry mouth to stomach irritation. Many women quit taking the overactive bladder medications after only 1 or 2 months. Problem is, these medicines need to be taken for life. If they're not taken for life, obviously they stop working as soon as you stop taking them. Other options for overactive bladder are physical therapy, where we do rehabilitation of the female pelvic floor. These are the muscles which support and hold up the female pelvic organs. Our physical therapy program is extremely successful. Women are saying that they get wonderful improvements in strength of the female pelvic floor, and they notice wonderful improvements in their problem with urinary incontinence. Another exciting option that we've recently been using, ever since it was FDA approved, is Botox injections directly into the bladder. Botox is a medicine that we're all familiar with. We've all heard of it. It's used for women who have these lines on their forehead like I do right there. The Botox is very successful in taking away wrinkles. What we've just found out is that it's equally successful in stopping bladder spasms. And the spasms are one of the main causes of overactive bladder. And an injection of Botox into the bladder can have a marvelous effect on a person's lifestyle and a tremendous effect on the improvement of their symptoms with urinary incontinence. These are some of the treatments, some of the problems that we specialize in and deal with day in, day out. The one thing that we're most distressed is how long women are suffering before they come to the doctor. My average patient has been suffering for over 5 years, wearing 3 to 5 soaking wet pads per day before they ever come seeking specialty attention from an expert in urinary incontinence. That's a shame. It's very frustrating to me. I feel sorry for every woman that comes in the door telling me that she's been suffering for 5 years or more, wearing 3 to 5 pads per day which are soaked, because in so many cases, these treatments are so easily treated. These problems are resolved with a 15-minute procedure in many cases. And it's very frustrating, even more frustrating to me as a doctor, when at least one woman every single day comes in and tells me that her own personal doctor told her that there are no treatments available for urinary incontinence and you have to live with it because it's the price you pay for being a woman. That's about the worst advice I've ever heard in my life. And unfortunately, we hear it every single day, minimum once a day, sometimes more. That causes frustration in the patient. It causes even more frustration in me as a specialist in urinary incontinence. If you'd like more information on various aspects of urinary incontinence, please go to my website. That's drfeinstein.com. Or we invite you to watch many of the video clips that we have scattered throughout YouTube. And you will get much more Very useful information on various aspects, treatments, and so on for urinary incontinence. Again, this is Dr. Charles Feinstein wishing you a wonderful day, and thank you very much for your attention.